Imagine a patient unlike any other you've ever seen. We're not talking about a single person here. We're talking about an entire nation, the nation of India. And right now, this patient is dealing with a highly complex, systemic nutritional diagnosis that literally touches over 1 billion lives. You see, public health nutrition, it isn't just about what's sitting on a dinner plate. It is the fundamental architecture of a society's survival, its growth, and its future potential. So in this explainer, we're going to unpack this massive, intricate system together, step by step.
So here is the medical chart for our patient. We're going to cover the cost of the nutrition crisis, diagnosing the double burden, manifestations and hidden hunger, the root causes of undernutrition, India's nutritional treatment plan, and finally, the ecosystem of public nutritionists. Starting right off with Section 1, the cost of the nutrition crisis, and setting the baseline stake.
Okay, let's dive into this, because to truly understand the absolute urgency of this crisis, we have to start by looking at those baseline stakes. Before we even get into diagnosing specific diseases, we really need to understand the sheer scale of what happens when a population's baseline nutritional potential is just compromised. And honestly, this number is staggering. Malnutrition is the underlying cause of at least half, yes, 50% of all deaths in children under the age of 5 in India. Think about that. Before a child even has a real chance to begin their life, inadequate nutrition severely compromises their immune system, making them vastly more susceptible to fatal infections. It is a devastating human cost right at the very start of the life cycle.
But, that human cost doesn't just stop there. It ripples outward into a massive macroeconomic drag. This compromised growth translates directly into a 2 to 3% loss of the national gross domestic product. To put that into perspective, for an economy the massive size of India's, that equates to tens of billions of dollars effectively wiped out every single year. When you have children suffering from low birth weight, experiencing lifelong cognitive deficits, and losing over 10% of their lifetime earnings due to lost productivity, it acts as a literal weight holding the entire country's economic potential back. You simply cannot build a thriving, robust economy on a foundation of undernerved citizens. You just can't.
Moving to Section 2, diagnosing the double burden, a nation divided.
Now that we've grasped the economic and human symptoms, let's transition to the actual diagnosis. And this brilliantly illustrates what makes India's nutritional crisis so uniquely challenging. It's fighting a brutal war on two entirely different fronts. On one side of the scale, primarily in rural and socioeconomically disadvantaged families, we have undernutrition. We're talking stunting, wasting, and severe deficiencies that actually exacerbate communicable diseases like tuberculosis and malaria because the body's immunity is just so low. But then, look at the other side of the scale. In urban centers, driven by a rapid shift towards sedentary lifestyles and processed foods, there is a rising crisis of overnutrition. This leads straight to obesity and triggers non-communicable lifestyle diseases like hypertension, diabetes, and heart disease. It really is a nation completely divided in its nutritional pathology.
Section 3, manifestations and hidden hunger, the visible and invisible symptoms. Let's step a little further into the examination room to see what this actually looks like in a clinical setting. The visual reality of severe undernutrition is shocking, specifically when we look at protein-energy malnutrition, or PEM. The devastating physical toll this takes on the human body clinically manifests in two primary ways. First, there's marasmus, which is caused by a severe overall deficiency of food and energy. The body essentially wastes away. And then there's kwashiorkor, which is caused specifically by a severe protein deficiency, and this often results in swelling and fluid retention. Both of these fundamentally break down the body's physical structure in just heartbreaking ways.
Now, a key clinical marker professionals use to track all this is stunting. Stunting simply means a child's height is less than adequate for their age. But I want you to really think about what that means. It isn't just about being a little shorter than average. No, it's a physical, measurable interruption of a child's baseline growth potential. The body simply does not have the nutritional building blocks it needs to grow the way it was genetically programmed to. But here is where the diagnosis gets kinda deceptive. I want you to picture an iceberg. Stunning and wasting, those are just the tip of the iceberg visible above the water. Lying right beneath the surface is something called hidden hunger. This is a totally invisible deficit of crucial micronutrients, minerals, and vitamins like iron, iodine, and zinc. Because, logically, a diet that's deficient in basic energy and protein is almost always going to be deficient in these micronutrients too. And what we can't see is often just as dangerous as what we can. To really understand how dangerous, let's look at the harsh reality of vitamin A deficiency.
which is a prime example of hidden hunger. Vitamin A is absolutely vital for normal vision and for immunity. When a child lacks it, not only is it the leading cause of childhood blindness, progressing from night blindness to complete, irreversible vision loss, but it also creates a vicious, self-sustaining cycle. The deficiency increases susceptibility to infection, right? Then the infection causes further loss of vitamin A in the body, which leads to even more deficiency. It's a deadly loop that is incredibly hard to break out of.
Which brings us to Section 4, the root causes of undernutrition, the pathology.
So, now that we've seen the symptoms, both the visible ones and the invisible ones, we have to ask the most important medical question: why? To diagnose the root causes, we really need to trace the pathology from the ground up. At the very base, the foundation of the disease are societal causes. We're talking about poor quality of resources, inadequate funding, and social systems that historically disadvantage women. Now, this feeds directly up to the household level, creating environments with insufficient access to food, poor maternal care, and terrible sanitation. That kind of environment almost guarantees the immediate individual causes: an inadequate diet and repeated chronic infections. And then, at the very top of this pyramid, we see the tragic outcomes: malnutrition, disability, and death. You absolutely cannot fix those top outcomes without healing the base first.
Let's move to Section 5, India's Nutritional Treatment Plan, the prescription. So, what is the cure here? Well, India has developed massive multi-ministerial government interventions designed as the nation's prescription to combat this incredibly complex pathology. A central pillar of this treatment plan is Poshan Abhiyan, which is the Prime Minister's overarching scheme for holistic nutrition. The government laid out an aggressive, phased timeline for this. They started in year 1 by targeting 315 high-burden districts, then quickly expanded to 235 more in year 2, with the ultimate target of complete nationwide implementation. The overarching mission is incredibly specific: systematically reduce stunting, undernutrition, and low birth weight by exactly 2% every single year.
To achieve that ambitious goal, the government uses a really smart two-pronged arsenal. First up are direct interventions. These are meant to treat the individual in the short term. This includes programs like the ICDS for early childhood care, specific nutrient supplements to fight that hidden hunger we talked about, and midday meals in schools. Fun fact, that's actually the largest school feeding program in the entire world. But remember that pyramid? To fix the foundational causes, they also need indirect, structural instruments designed to heal society in the long term. This includes the public distribution system for food security, poverty alleviation programs, and crucial social modifiers like improving basic sanitation and empowering women's status in society.
Section 6, the ecosystem of public nutritionists, the caregivers.
Now, a prescription is totally useless without doctors to administer it, right? To deploy this massive treatment plan across the vast, diverse geography of India requires a highly coordinated human element. Let's move to and see how this builds up within India's healthcare infrastructure. At the primary level, you have primary health centers. These are the crucial first point of contact for families right in their local villages. When cases get more complex, they flow up to the secondary level at district hospitals. And finally, the most severe, highly complex cases bypass those lower tiers and are treated at the tertiary level, at advanced specialized medical colleges like AIIMS. And right in the center of this massive, sprawling infrastructure is the public health nutritionist. They are the essential linchpins binding the whole system together. They don't just sit in clinics all day. Their ecosystem is incredibly vast. They influence government policy, they coordinate with global NGOs like UNICEF, they deploy those feeding programs in schools, advise corporate CSR initiatives, and they even drive the latest research in academia. Honestly, they are the orchestrators of the nation's health.
So the crucial point is this: to truly resolve the double burden of malnutrition and ultimately restore India's national economic potential, the public health nutritionist must perfectly balance two highly interconnected strategies across all levels of care. On one hand, they must drive food-based strategies like community education and public distribution. But simultaneously, they have to execute nutrient-based strategies like targeted micronutrient supplementation. It is a constantly moving, highly tuned machine.
Which brings us to the final thought I want to leave you with today. We've seen the devastating human costs, the complexity of the double burden, and the massive architecture of the cure. But I want you to take a second and reflect on this. If public nutrition isn't merely about feeding people, but is in fact the fundamental building block of a nation's economic potential and survival, what happens to the future of a country that fails to treat its invisible hunger? Think about that. Thank you so much for joining me for this explainer, and keep questioning what you see beneath the surface.